and good morning. Welcome. We're on behalf of Texas Children's Hospital and Baylor College of Medicine. I'm pleased to invite to welcome you to our plenary session, Women Leaders in the COVID-19 Pandemic Response. Our moderator for this session today is Dr. Peter Hotez. Dr. Hotez needs no introduction for many of you who follow him on television and newspapers or one of his over 100,000 followers on Twitter. Dr. Hotez is Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine, where he is also the co-director of the Texas Children's Center for Vaccine Development and Texas Children's Hospital Endowed Chair of Tropical Pediatrics. Dr. Hotez is also university professor at Baylor University. He's fellow in disease and poverty at the James A. Baker III Institute for Public Policy at Rice University, senior fellow at the Snowcroft Institute of International Affairs at Texas A&M University, faculty fellow with the Hagler Institute for Advanced Studies at Texas A&M University, and health policy scholar in the Baylor Center for Medical Ethics and Health Policy. Dr. Hotez is an internationally recognized physician scientist in neglected tropical diseases and vaccine development. As head of the Texas Children's Center for Vaccine Development, he leads a team and product development partnership for developing new vaccines for diseases affecting hundreds of millions of children and adults worldwide, including COVID-19, while championing access to vaccines globally and in the United States. Dr. Hotez has authored more than 500 original papers and is the author of 4 single-author books, including his latest, Preventing the Next Pandemic. He's also served in various capacities representing President Obama, the U.S. Department of State, and the U.S.-Israel Binational Science Foundation. Most recently, as both a vaccine scientist and autism parent, Dr. Hotez has led national efforts in the U.S. to defend vaccines and to serve as an ardent champion of vaccines going up against a growing anti-vax threat. Thank you, Dr. Hotez, for agreeing to lead this important panel today, and I'll hand it off to you.
Well, thanks so much, Adam. We do have really quite an extraordinary panel today. You know, I think one of the aspects of COVID-19 and the response that many people are starting to realize, but has never really been said explicitly, which I think needs to be said, is the extraordinary role of women scientists and women public health experts is leading some of the most important aspects of COVID-19 control and prevention, and also leading the establishment and creation of a lot of the biotechnologies that we have in order to control COVID-19. And you know, we thought it would be really important for the CUGH meeting to at least have one session on the critical role that women scientists and public health experts have in controlling COVID-19. And we have a panel of 4 extraordinary women leaders and scientists, and I just want to briefly introduce them in order to leave a fair bit of time for discussion. And then we'll go into, they'll make individual remarks, and then we'll have the opportunity for Q&A. So our panel includes Professor Agnes Binagwaho, who's a pediatrician, and has the important role of Vice Chancellor at the University of Global Health Equity. Since 1996, she's provided clinical care in the public sector, as well as had a number of project management, health system strengthening, and government positions, including permanent secretary of the Ministry of Health of Rwanda from 2008 until 2011, and the Minister of Health from 2011 to 2016. And then in September, she was appointed as Professor of Global Health Delivery for the University of Global Health Equity, also known as UGHE, in Kigali, Rwanda. And in April 2017, she was named as UGE's Vice Chancellor and Chief Executive. So conducting extraordinary work in sub-Saharan Africa and globally. And then second is someone who I've had the honor and pleasure of partnering and working with for the last 20 years, and that's Dr. Elena Batati, who's Associate Dean of the National School of Tropical Medicine at Baylor and Professor of Pediatrics and Distinguished Professor at Baylor University in Waco, Texas. She directs research and administration for the section of pediatric tropical medicine, is deputy director of the she's co-director of the Texas Children's Center for Vaccine Development, and Dr. Batati is also editor-in-chief of Current Tropical Medicine Reports, associate editor for the Public Library of Science, Neglected Tropical Diseases. She's been honored and lauded all over the world, including the highest honor from the government of Honduras, their National Science Award and Medal of Honor from the Honduran National Congress, and she was also awarded the Leadership Award in Science and Technology from the Honduran chapter of Vital Voices. She obtained her doctoral degree from the University of Florida in molecular immunology and experimental pathology. Then she was a postdoc at the University of Pennsylvania, and then was on the faculty at George Washington University, where we began working together, co-heading this product development partnership. Our third panelist, someone I've also worked with for a long time, Dr. Alison Galvani, who's a professor of epidemiology and ecology and evolutionary biology at Yale University. She did her DPhil at Oxford University, doing important work with Robert May and transmission dynamics, really where transmission dynamics was founded. She was a postdoc at UC Berkeley, and she's been doing extraordinary work on modeling epidemics for influenza, and really has been the go-to person for so many aspects around COVID-19, especially around heterogeneity of infection, which she first pioneered when she was a graduate student. And finally, Anna Maria Galvis is Executive Director of the Baylor College of Medicine Children's Foundation, Colombia. She's a specialist in communication and government affairs with vast experience in leading communication initiatives to strengthen the reputation of her work. She has over 12 years of experience in managing relations with governments, communities, and licensing. She's certified in social, environmental, health impacts and holds a business administration major from the Colegio de Estudios Superiores de Administración. She has a strong leadership and has been a really critical person leading Baylor's activities in Colombia and working with some of the YU indigenous people, especially in conducting a lot of pioneering work. So quite a panel, and I'm going to start initially with invite Professor Binagwaho in order to speak to us and tell us about her important work in Africa and globally. So, Professor, please.
Good morning, good afternoon, good evening to all of you, wherever you are in the world. It is a pleasure to be here today to join the panel organized by the Baylor College of Medicine. Today, I will detailing the challenges and triumphs of women in global health and how gender inequity plays a role in the representation of women leaders in academia, research, as well as the way forward for academic institutions. Next slides. Gender imbalance in research and academia is a global issue that is not new. Gender inequity is due to a deep structural and institutional violence that prevents women from rising to higher level of leadership. Because of this, today, we see only 5% of women global health leaders from low and mid-income countries, and only 39 of the top 20 universities in the world are run by women. This gender disparity is also in research, where only 30% of the world's researchers are women, even though the rate of women enrolling in university is increasing. Furthermore, women researchers are typically found in government sectors and not in private sector, where there is a higher salary and better opportunities. They are generally reserved to men due to gender bias and discrimination. Women's inabilities to be promoted today's higher positions have been described with the metaphor of glass ceiling, but there is also the recent use of the term sticky floor, where women are stuck in their position by the lack of investment, as well as the leaky pipeline, where the percentage of women in higher education and research declines as they move up to the ladder. This leak in the academic pipeline is due to various causes, such as gender discrimination in hiring practice, in salaries, and women's personal life. By understanding what causes this leak in the pipeline, we can design better solutions to this problem. Other factors that either success of women during the pandemic is that many societies still embrace the gendered domestic work. The graph on this slide shows that women are disproportionately affected by COVID-19 induced school closures, causing them to be at home with their families while schools and childcare facilities remain closed. Because of this, women in science and global health who cannot work from home will have their careers derailed due to school closures and limited childcare facilities, further contributing to the lack of representation in academia and research. Promotion and retention of women global health leaders creates a ripple effect to leverage health outcome for not only women, but society in general. However, the lack of representation is further shown in statistics from WHO that shows 72% of executive positions of global health organizations are held by men, who are also 50% more likely to hold senior level positions in global health NGOs. Additionally, women are overrepresented in the global health workforce, yet underrepresented in global health leadership. When we do not have policies, strategies, and frameworks set in place to mitigate these disparities and correct them, we see a negative impact on health outcome and on achievement of the SDGs. Women should have everywhere a seat on the table in global health decision-making process. As gender equality is the fifth Sustainable Development Goals to reach by 2030, what can be done to better support women in academia, research, and also to ensure their representation in these sectors? In my country of Rwanda, the government ensured that laws and policy are in place to promote women in society, such as the gender budgeting, where the government, the executive branch, have to show the parliamentarian what budget line are there to mitigate gender inequalities and advance the agenda of gender equity promotion. There is also the rules to ensure female representation in parliament, meaning the minimum of any gender to be represented in parliament is 30%. And we have the parliament where we have the highest percentage of women because year after year, voting for women please the population. I want to recall that women are less corrupt than men. In the rural north of Rwanda, my institution also is contributing to female representation in global health sectors. We create a more gender equal mix of global health researchers, leaders, and practitioners in my institution, the University of Global Health Equity, where we need to have a minimum of 50% of female in each master's and 70% of female in medical education. This is the rule. Gender equity is a central mission of UGH, my institution, and our Center of Gender Equity gives support to these women, students, and staff and faculty through our in-house mentorship program. And also, the disaggregated data is collected through our yearly gender and diversity audit that ensure we are striving to grow in this area and continue our journey to gender equity. I thank you.
Well, thank you very much, Professor, for that very important topic. A lot of high-level aspects that I hope when we get to the panel we'll be able to go through in a lot more detail. Thank you for it was extremely inspirational, and I deeply appreciate your comments and being with us today. I'm now going to switch to Professor Mary Elena Bottazzi, who co-directs the Texas Children's Center for Vaccine Development, and should also mention is leading a very important effort now to develop a COVID-19 vaccine being scaled up for production in India. So Mary Elena, please.
Thank you, Peter, and welcome everybody. And I think today what I'm going to do is give you a little bit of my story. And as Peter said, for the last 2 decades, I have had the privilege of co-leading with him a vaccine center that it's really dedicated to development and testing of new low-cost and effective vaccines against emerging and neglected tropical diseases. But we do so by also linking our activities to building and strengthening capacity for vaccine development, not only locally, but with foreign nations, which I think, as you know, in this time of pandemics has shown to be quite essential and important. But also, I think we should not forget that also the work that we do is quite transparent and disseminated in order to really also guide and influence vaccine policy and advocacy. So the success of our vaccine center, certainly led by me and Peter, really is not by ourselves alone. And it actually includes more than 30 global partnerships, and many of them are led by women, with expertise in research, engineering, public health, and many other disciplines. So for instance, just within our own group in Texas Children's and at Baylor College of Medicine, the level of diversity that we have brought in and that it is within our teams is actually quite amazing. In fact, half of our workforce are women, and they practically bring together an array of not only scientific experience, but representation from all over the world, regions from, many regions. And this really spices up our group. And it provides an array of, culture, networks, and also leadership styles. So I think one of the questions that we are posed for this panel is, what kind of advice do we have for young women that are seeking career in vaccine science? So I would say focus on qualities that really need to be built and or reinforced during your personal and professional growth and fall. I call them the TMLs, the training, mentorship, and leadership. So let me elaborate a little bit what TMLs are for me. So my training was in microbiology and clinical chemistry, and I actually got trained in Honduras at the National University of Honduras. And there I was actually pretty lucky because in countries like Honduras, we get really solid educational foundations in many of the diseases that in fact we have them pretty much in the front of our noses, right? So tropical diseases are widespread. And importantly, it also gave me this initial ability of the introduction into why research, basic research, translational, clinical, operational research is so important, not only to design and develop technologies that of course we would like to use to solve these global health problems, but I think more importantly, recognize that research and development really has a footprint in ensuring national regional security, but also certainly the ecosystem for a good economic backbone for a country. And I think, clearly women, have a big role in this respect. From there, from with the time that I was in Honduras, and I really felt that I needed to complement my hard skills, my technical scientific skills, by really receiving a little bit better, broader training. And when I came to the United States, like Peter mentioned, I trained at Penn and at the University of Miami. I really complemented my really hands-on field clinical tropical medicine experience with molecular immunology, experimental pathology, cell biology, and genetics. But I think what really was a revelation for me is that I really didn't stop there. I have always been fascinated with the business aspects of science, the business management, and the how do you really operationalize the research. And so as a hobby, to be quite honest, it was sort of as a hobby. Instead of going out and drinking in bars, I practically went and started a strategic management program in Temple University. And I really was fascinated by, how do you integrate, the game-changing disciplines of going beyond the scientific underpinnings, but really understand how to convert science into useful tools with economics, ethics, engineering, and the social sciences. So that's, pretty much how my training was very multidisciplinary and with many disciplines, which some people say stay focused. I would say, sure, stay focused, but really have the ability of even looking at many different aspects, not just health, right? The second pillar is, of course, mentorship networks, right? The M. And at every step of the way, and in fact, probably you don't even realize it as you're growing professionally, is that you're creating a very important and special set of relationships, right? You're networking, you're mentoring. And many of you probably listening to this conversation, why would this be important, right? Because first of all, they would bring diversity of attitudes, ideas, talent. They're really the pillar that supports you, right? They open doors for you. They're actually your business card that connects you to the world. So make sure, however, that when you're creating these networks, they're genuine, that these relationships are actually a two-way street, and they have to really be fair, respectful. They have to share your values. They have to, of course, be cognizant of biases, and they have to inspire you and be trustworthy. At the end, I'm also going to talk to you a little bit about leadership, right? And I know that the word leadership, sometimes it may be even taken out of context. So what is really its meaning? So actually, leadership is an action. It is not a title. So to be honest, all the laundry of titles you may have, that doesn't necessarily say that you are a leader, right? A leader as an action is the action of putting the teams at the center of how you are advancing your goals. It's you asking the difficult and important questions to those around you and to yourself. It's sharing that responsibility and accountability and being inclusive, right? But it does require practice. And there's many ways that leadership, as an action can be implemented, right? First, it has to be transformational. And what does that mean? It has to be valuable and contribute to incentivizing others. It's not a benefit for you, it's a benefit to others. So you're looking out for others, you're encouraging others, you're empowering others, you're motivating those new generations. And I think we women know very well how to be a transformational leader. We also have to be adaptive, and we're able to thrive, especially during challenging environments. So certainly the pandemic has been the epitome of what it means to be adaptive, right? And it's an adaptability that has to be individual and collective, right? Meaning that we have to mobilize, thrive, preserve, flourish, rather than perish, regress, and contract, and just complain about it. And I think women, again, here have shown that we can really be those anchors of change and rely on our diversity of creating a holistic balance and alignment. Because to be quite honest, we as women are very flexible and adaptive, right? Both personally and professionally. But it does require that we don't forget that we have to have our own confidence while maintaining humility and drive and the vision of bold goals, right? And we have, of course, to have perseverance and stay really energized while doing so. So bottom line is, and I can tell you, I've even recognized myself something that I thought I didn't have, and I now recognize that probably I did, and I just didn't want to accept it, is that I have moral courage and certainly the willpower of influencing that sustainable change and working with a team to really disseminate this knowledge even in the community. And I think this year and a half that we've been going through the pandemic has really been amazing, really, recognizing all the abilities that we all have, especially within our team. So in closing, again, more than 20 years working alongside Dr. Hotez, and he's like a bee, or maybe sometimes like a mosquito. He constantly buzzes in my ear. And what he says to me, and I tell you, I honestly, every morning, I hear his voice and says, remember, seek inspiration, be original, surround yourself with people who are positively influential, but most importantly, be good and kind to others, especially when those are going through tough times in life. But I really know that Peter says this because who gave these pearls of wisdom to him actually came from his mother and from his wife, Anne. So there you go, Peter. You know, Anne and your mom keep buzzing in your ear, but then you buzz your ear into me, and I hope I can buzz my ears to others. So women are essential components, and they're definitely powerhouses of transformation. So we are really the structure that belongs to the future of global health. So thanks so much for this opportunity.
Well, thank you, Professor Batazzi. I loved your words, and indeed, I gain my strength and inspiration from the greatness of women, and especially women scientists and public health experts who have truly inspired me since the beginning of 2020. And it's been such, as you point out, just an incredible struggle for everybody. And it's amazing to see how women scientists and public health experts and physicians have really led the charge in commanding this response. Thank you again. I want to move to Professor Galvani and hear what she has to say. And she, of course, has done so much important work in the epidemiology of COVID-19 this year. And so, Allison, it's an honor to have you here.
Thank you so much, Peter. Let's see, I'm just having difficulty sharing my screen.
I can see you.
I have slides to share, but well, I could talk without the slides. That's fine. So yeah, so I'm sorry about that. I had slides prepared, but I'll just have to go ahead without them.
Sorry about that.
Oh no, I think it's probably on my end. So yeah, thank you so much, Peter, for that kind introduction and for the opportunity to speak along with this impressive group of global health leaders. So in charting a path forward and strengthening our preparedness against future pandemics, I think it's important to reflect on how the US ended up with 20% of the COVID-19 deaths, despite only comprising 4% of the global population, especially in light of our unsurpassed GDP. So I believe the first misstep dates back to 2018 when the Trump administration dismantled the global health security unit that had been dedicated to pandemic preparedness without expertise and stumbled over pivotal opportunities to control the outbreak earlier. As we squandered the first weeks following reports of a novel and respiratory virus.
Allison, I think you may be having some internet connection issues. Let's go to our final panelists, Anna Maria Galvis, who is running the program in Colombia as executive director of Baylor College of Medicine's Children's Foundation in Colombia. So, Anna Maria.
Good morning, all. Good afternoon. I just want to check you're hearing me properly.
Yes, yeah, a little bit muffled, but I think it'll be okay.
Okay, let's try it. Let's try it. So I want to thank all the efforts that have been placed into this dialogue. I do believe that women have played an enormous role in the global response to the COVID-19 pandemic. And one of the things I would like to talk to you about today is divided maybe in two aspects. The first is just like sharing with you a practical case of how we adapted our programs in Colombia to face the pandemic, specifically to have some COVID-19 tests in place in one of the regions we work here. And the second one is to evidence maybe what advice, and this is more a personal experience that I want to share with you all about how women can evolve on a global health environment around the world. So let me start by mentioning that around the globe, and mostly in low-income countries, we continue seeing health just as the absence of the disease, of the pathology, or the infirmity. And if we don't work with the concept that was actually defined by the WHO of seeing health as a complete state of physical, mental, and social well-being, a lot of resources will be maybe waste. So just to give you a little maybe framework of what we do in Colombia, we work actually with the largest indigenous population in Colombia and Venezuela, with 90% of basic needs non-satisfied, lack of water, lack of food, lack of work. And this is mainly what you can find around the globe. These are the determinants of health. So we establish an holistic model that looks to support the reduction of high infant, maternal, and mortality rates in the population of Colombia, specifically in La Guajira state. So what do we do exactly? We have four aspects that we work in. And let me share at the beginning, we were starting with education. So the four axes we are working with are health treatment. Basically, we implement an ethnic health model that is fair, consistent, and culturally relevant. And I want to highlight consistent. A lot of the NGOs around the world come and go. And this is leaving in our countries a lot of gaps and a lot of good thinking about how health should be approached, but not consistent resources to manage the problem. So we provide healthcare and treatment. We have outpatient consultation, diagnostic support, early detection, nutritional recovery centers, health centers. So we have just like mechanism to approach health with another important message. If we don't work with the health system, maybe the patient is being left alone during the pathway for its recovery. So that's another important issue, that if you are willing to work in global health, you can be having in your mind. The second one we work with is education. We work with community education, mainly with the indigenous population, and also with health professional education. Whenever you are in isolated or vulnerable areas, usually the health professionals are not receiving the best training. So you need to work on both sides. So you can cover all the efforts to strengthen the local capacity in health. The third one is, as an NGO, we capture tons of information, tons of data, and we are very organized on managing this information, and we establish a component where we do research and development. We promote the development of research initiatives that contribute to strengthen the current gaps in the healthcare model, so the national policy can be adjusted. And the last one, that is I think the one that we enjoy more, it's complementary activities, because actually that is where you see the change in the situation you are managing. So we are working on programs with food security and economic development. So that way we can help to resolve the high infant and maternal mortality rates. So what we did, basically when COVID emergency was declared in Colombia, we established the coordination and governance mechanism as Baylor Foundation in Colombia to implement some critical actions we're facing that was coordinated with local and national authorities. We are governed by the Ministry of Health, by also as an NGO, we are governed by our sponsors, because they are the one who trusted their resources for specific purposes. So we needed to realign that. So we established two specific objectives. The first one is that we needed to give continuity according to the resolution in the country, that is basically continue with the first level attention. I mean, birth control, vaccination, family planning, all these aspects that are not high complexity health delivery aspects, but we needed to have them continuously moving, so we won't overload the capacity of the health system by these pathologies, and added the COVID-19 pathologies. And the second objective was to contribute to the detection and timely referral of probable cases of COVID-19 through the use of our outreach programs. So we presented to our board, and we working in this program. information indigenous to handle aspects. But why was Baylor working in COVID if we were basically focused?
And I think you're breaking up too much. So why don't we try to see if we can move on to see if Professor Galvani has been able to get her internet up, and then maybe we can move to the discussion. We're getting a bit, unfortunately, we're getting a little bit tight on time, so maybe a sort of an abbreviated presentation, and then we'll go right to the panel.
Sure. So I think where it cut out, I was talking about the delays in diagnosis, and we can see that reflected in the number of tests that were administered in the US compared to South Korea, which had confirmed its first case the very same day that we did. And the per capita comparisons of testing are even more stark. South Korea is an example of a country that hit the ground running in their implementation of widespread diagnosis, and they rapidly curbed COVID-19. In contrast to the universal health care provided in South Korea, more than 37 million people in America have no health insurance, and another 41 million people in insurance, which means that the co-pays and deductibles are not affordable relative to their income. Compounding the problem, the US is the only high-income country that does not guarantee paid sick leave. So in addition to being inhumane, it puts our entire society at risk when some among us do not have the means to stay at home if they or their children are sick. So in early 2020, we projected the need to expand ICU and ventilator capacity. And unfortunately, these projections were borne out by what occurred first in New York City and subsequently in hospitals across the US, as the influx of critically ill patients quickly overwhelmed healthcare facilities. Our results on self-isolation of mild cases, even just a proportion of mild cases, underscored the impact that paid sick leave could have on mitigating transmission, thereby flattening the epidemic curve and delaying the peak. So in turn, some of the burden on the healthcare system would have been alleviated and time provided to scale up production of vital medical equipment. So an unusual aspect of COVID-19 is that the peak of infectiousness occurs during the pre-symptomatic phase. By translating data on viral shedding, symptom onset, and age-specific mixing patterns, we determined the contribution of transmission to COVID-19 spread in and between age cohorts. What we found was that the majority of transmission is attributable to people who are not exhibiting symptoms from a combination of the pre-symptomatic stage and from infections that remain asymptomatic. So not are people infectious when they're not symptomatic. The symptomatic is actually when they are most infectious. The consequent inadequacy of symptom-based control or symptom-based isolation highlights the importance of contact tracing that is rapid enough and extensive enough to identify cases before they become symptomatic. I'm profoundly grateful for the extraordinary rapidity of COVID-19 vaccine development, building on decades of work on mRNA vaccines by Peter, among other vaccinologists. The speed of vaccine development has been unprecedented. An initial challenge was the optimization of allocation of those vaccines when they're still in limited supply to maximize public health benefit. And knowing that my colleagues and I had previously shown that flu vaccination is most effectively allocated to younger individuals when there's limited supply because of their disproportionate contribution to transmission, a number of people contacted me asking if that would be the case for COVID-19. Given that COVID-19 is transmitted in similar ways to flu, it might seem intuitive that what is optimal for flu would also be optimal for COVID-19. However, the magnitudes of age-specific differences in case fatality rates are so much greater for COVID-19 that direct protection of older individuals dwarfs the impact of age-specific contact patterns. So for example, for COVID-19, hospitalization of individuals over 70 is 46 times greater than for people under 30 years, compared with 9 times for flu. So where do we go from here? Fortunately, the Biden administration has made strides towards reversing the growth of this pandemic. President Biden recently implemented the Defense Production Act to expedite the scale up of vaccine production. In the previous administration, the only time it was used was to maintain the meatpacking industry. Moving forward, addressing disparities will be important to ensure equity and access to the vaccines, and producing enough vaccines for the entire global population should also be a priority. And as Maria discussed, this is indeed the focus of Maria and Peter with advanced clinical trials for their low-cost vaccine underway in India. So even as cases and deaths are starting to decline with the rollout of vaccination, it is premature to lift non-pharmaceutical measures such as mask mandates, as governors in various states have done. So such action risks a rebound and endangers the gains that we've made over recent weeks. In addition, the more cases there are, the more opportunity there is for more transmissible or more virulent variants to evolve, as we've indeed observed. Continued investment in pharmaceutical research to improve treatment will further reduce the mortality and hospitalizations. In the event of natural disasters, there are emergency FEMA funds that can be immediately tapped. And I believe it's imperative that a comparable fund be established so that the country can respond more expeditiously to contain outbreaks before they become unmanageable. Finally, our fragmented healthcare system inflamed the pandemic. Disease transmission is exacerbated if people delay seeking diagnosis and treatment because they are concerned about medical bills. Universal healthcare would protect the well-being of Americans on both an individual and a societal level. So thank you again to the organizers for the invitation to speak today. And I apologize again for my technical issues.
Yeah, no worries, Allison. That was terrific. You know, we only have a few minutes left. There's so many good questions, though, in the questions section. We could do a whole hour just with these questions, which I think are pretty amazing. But let me go to a couple of them, which is one is, let me ask, start out with Dr. Binagwaho and ask the others as well. With the same question, and we'll see if we can get to everybody. But the first question is, in general, do you think women do better with female or male mentors? It's likely dependent on the mentor-mentee match, but still curious what you might advise young women seeking mentors in research in global health. And this comes from Quentin Eichbaum.
I think that the mentor, you should choose the mentor according what it can give to you. First of all, you need a mentor that is in your field, understand what your needs are. And being a male or a female is not what matter. What matter is how you match together and the support that person can give for your career, for your studies, for your professional life, and also sometimes for personal life. So it depends to each other. And in some countries, not easy to have a mentor from another gender, another sex. So context and personalization.
Brilliant. Love that. Dr. Batazzi, what do you think?
Well, I have to say I agree, because it doesn't really matter what gender it is, what age it is. It can even be, a little kid that supports you because it puts you in context. Also, what are the priorities in your life, right? But like with life, you have people that you get better along with than with other people, right? And that's including, of course, sometimes even within your own family, right? But I have a feeling that, it doesn't really matter as long as I mentioned, that this mentorship or guidance, it's a two-way street, and that indeed it's genuine, right? That you know that the relationship is really genuine, that you are seeking help or advice, and that this person is really committed to giving you, the perspective in a transparent and genuine manner, without, of course, trying to put barriers in front of you. So,
very nice. Professor Galvani.
Well, I agree with the sentiments that were just eloquently expressed by my colleagues here. And I think, yeah, I think generally it doesn't matter. I mean, there are examples, and Peter is a prime example of men that are extremely supportive of women scientists and nurture them. So I think, the individual personality and expertise is paramount.
Great. Anna Maria, are you with us?
Yes, I'm here.
Great.
I will add that any mentor is the one that needs to be with you at this moment. Yeah, if you find maybe not a perfect mentor, that's the one that life has put in front of you, and there is a lot you need to learn from him or her, and that's what you will need to look for. I do really avoid a lot of the discussions that happen between supervisors and employees because of different personalities. The one that you have in this moment in your life is your perfect mentor, I will say.
Excellent. All right, now I'm going to ask you a tougher question here from an anonymous attendee. And they ask, how do you handle pushback when you do not have allies who support women leadership in global health? What tangible policies have been demonstrated to encourage women leadership in global health? Are there any examples that are feasible? So let's go in the same order again. Dr. Binagwaho.
So I think gender equity is not easy to make it happen. You will always have pushback, and sometimes by people it's bias. So persistency, and you have to find ally. If not, you will break. It's not easy to fight together alone. And also, don't put. My advice is go and fight for inside a good institution. It's not a political advice I give, but inside a good institution, don't go for the battle you will lose because you may roll back. Be strategic and always find what is the next step I have to reach and fight for that next step. You cannot always go straight where you want to go. The important is to start the journey and go with consistency.
Brilliant. You have to take that first step. I love it. Dr. Batazzi.
thank you. Yes, I totally agree. And maybe just giving you an example of, real life, and Peter, I guess I can share this, right? I mean, with Peter, we've worked 20 years, and that doesn't mean that it has been easy, because you have to adapt, within your institution and within the crisis or how the field goes, right? And working in neglected diseases is so certainly not an easy field. We're always competing, right, to get funding. We're always competing to raise the priority when, of course, there's so many other diseases, but at the same time, we know that our diseases, of course, are the ones we think are the most important ones, right? But there was a time where we learned with Peter, and that's why I think I love to, go more deeper into this concept of leadership. And it's that real distinction of transactional leadership versus transformational or adaptive leadership. And we even went through an exercise with Peter where we seek some coaching advice, which was kind of like an independent person that knew nothing about neglected diseases, knew nothing about science, knew nothing about research, knew nothing, right? Somebody totally outside, and really raised our awareness of how to recognize those cues. And that gave us pretty much the resilience and the persistence and the ability of responding to difficult pushbacks.
Yeah, I remember that. Actually, it was your idea for the coach, Mary Elena, and it was brilliant because it should have been obvious to us, but sometimes you need somebody from the outside to come in and make you aware that very difference between a transactional individual and a visionary and a transformational person. And now I see it through that lens all the time, and it's extremely helpful and useful, just by putting words to it. Dr. Galvani, what do you think?
Well, again, I agree with the insightful comments that were already made. I think that it can be extremely disheartening when there's pushback, especially if you feel there's implicit biases there, gender biases or other biases. And finding allies, talking to other people to find allies so that you're not on your own, is both helpful emotionally and also pragmatically in taking a stand with a larger group of people is ideal.
Thank you. Anna Maria, last word.
I do think that small results will be the first step to achieve this transformational leadership that Maria Elena has placed in this conversation. This is an enormous competence that you need to build on if you want to work in global health. And I will add that the second opinion that I can share with you is that whenever you let others talk for you, just like express on the results you have achieved, you will enhance and receive policies that will support your work.
Well, thank you so much. I could easily go on for at least another couple of hours with this part of the panel because I know I'd learned so much, but I think the organizers probably wouldn't like it. There's one comment here that says, "Thank you so much for the panel. Amazing session. One of the best sessions so far in the conference." So thank you so much for making this an extraordinary event, and thank you, professors, for your amazing leadership in helping us through this COVID pandemic. And so, Adam, I'll turn it over to you.
Thank you, Dr. Hotez, and a big thank you to all of our panelists. This was a great discussion and great presentations. We really appreciate it. And to the participants, we'll follow up on any unanswered questions and provide additional details. And this recording will be available in the future as well. Thank you.
Thank you so much.